help with.
Thank you so much, and thank you for the invitation. Let me see. Are you all able to see this?
Yes, thanks.
Okay, wonderful. My name is Lisa Cerceo. I am an internist and a hospitalist, and I've been involved with some sustainability work, specifically in greening healthcare. I've been the chair of health and public policy for the American College of Physicians, the New Jersey chapter. ACP is the second largest group of physicians, second to AMA. So I'm going to just do a very, very exceedingly brief overview of health and climate change, and then we'll go on to a little bit of what we've been doing in the state and the task force that we gathered. So obviously, everything that is happening with the environment impacts our health, whether it's air with particulate matter 2.5, which has impacts on cardiovascular system, our respiratory system, even cognition and birth outcomes, things like nitrogen dioxide associated with incidence and worsening of asthma and respiratory conditions, ozone, certainly water, and whether we're talking about water pollution or floods, droughts. When we look at land, we not only talk about things like crop yields, which are decreasing in terms of a rising CO2 concentration, the actual nutrient value is also decreased. And life, because we're certainly entering into the Anthropocene, and so the impacts on biodiversity have obvious impacts on health. So the tenet is that we cannot have healthy people on a sick planet, and that's something that in medicine we're increasingly realizing. And when I give this talk to people in New Jersey, I'll stress the fact that average temperatures have already risen in New Jersey almost 2 degrees Celsius, and in some part that's due to the AMOC. There's jet stream currents, and the poles rising quicker than the equator have a lot to do with the rapid rise in this area. So again, just exceedingly quickly, and I'm happy to talk offline if anyone has questions about health and climate change, but we'll often think about these earth systems and then the mechanisms by which they can impact health. So if we take something like higher temperatures, floods, and droughts, which can lead to something like wildfires, that can then lead to respiratory disease because of all the particulate matter, acrolein, formaldehyde, all of these other things that are in the air. It can lead to cardiovascular disease, and it can lead to mental health and even maternal adverse outcomes. This is a nice infographic from the CDC, which again just has a very broad strokes overview of all the systems that can potentially be impacted by climate change. And again, we could go into each one of these in great detail, but I'll just suffice it to say that there's a lot of impacts. Every organ system that you can refer to can have a corollary impact from climate change. Sorry if this got cut off a little bit, but so that this was one of several factors that look at the overall impacts of particulate matter and air pollution. This one estimates at about 9 million deaths, and if you're looking at the cumulative impact, that's more than any violent crime, that's more than tobacco smoking. So the impact of premature deaths far outpaces. There is some other work from the T.H. Chan School of Public Health that puts that number at over 10 million, which ends up being about 16% of all global deaths. So it's certainly a huge public health factor and something that physicians should care about and should be working on. We often will talk about environmental racism and environmental justice in this issue, and certainly we see a lot of economically deprived patients, and we see the outcomes on the social determinants of health. Again, all of this is a talk in of themselves. Particulate matter 2.5, you can see here some of the impacts. There's some more definite, there's some associations, but certainly it's wide-ranging impacts. And because they are so small, they can get into the distal airways, the distal alveoli, and traverse into the bloodstream. And it's because they get into the bloodstream that they can then cause an inflammatory reaction. And so it's that inflammation that is thought to lead to a lot of the cardiovascular events. CVA is a cardiovascular event like a stroke, or an MI is a heart attack. So it's a lot of it is that inflammatory pathway that leads to these adverse outcomes. And this is an infographic from New England Journal of Medicine, just showing cardiovascular disease and the numerous ways that that it can be impacted, whether it's from climate change itself and temperature extremes. We know that today was extremely hot, and we know that cardiovascular disease, arrhythmias, heart attacks all happen more in these temperature extremes. And we've also seen that with COVID, some of the racial discrepancies that we've seen with COVID outcomes are in part due to exposure to particulate matter 2.5. And this was borne out in studies from Italy, from China, and also here in Boston, that there's a 15% increase in COVID-19 death rate for every 1 microgram per meter cubed increase in particulate matter 2.5. So with all of that as a backdrop, this justifies why it's so important for us to be doing sustainability in our backyard, in our hospitals, in our clinic practices. And so if we look overall at the global healthcare sector, healthcare in and of itself would be the 5th largest emitter, and just the US healthcare center or healthcare sector would be the 13th largest emitter. It would actually put us above South Korea, above the UK. And we know that our health system is very wasteful on many standpoints, and we don't necessarily get better access or quality of care with that those excess greenhouse gas emissions, that excess waste. So you end up with this non-virtuous cycle. And in this study by an anesthesiologist, it resulted in 388,000 disability-adjusted life years just from pollution. And so you end up with this non-virtuous cycle where the healthcare sector is causing poor health. We have people coming in to get treated. That results in more waste, more climate and environmental degradation, which then exacerbates poor health. So what we wanted to look at was what we could practically do in the healthcare setting, looking at scope 1 emissions, which are direct emissions, scope 2, which are indirect, like purchased goods, mainly purchased electricity though, and then scope 3, which is the largest share, and that's everything else. So that's things like prescriptions, it's all of the non-medical equipment and the medical equipment. It's laundry and waste disposal, commuting. So the scope 3 emissions, really, you could have a big bang for your buck looking at that. And again, looking at the overall impact, that scope 3 is 80% of the greenhouse gas emissions from the healthcare sector. So if we look overall throughout the hospital and the outpatient setting as well, there's several areas. Certainly our clinical care is something that I'll frequently talk about, but there's many interacting systems that we can also lean on. So we had gathered a task force of representatives of many of the major healthcare systems across New Jersey, and we wanted people to give their insights. And what we came up with was 13 overall categories that we thought that the healthcare industry should get behind and should focus on. Some of these are general things like waste, things like energy. Some of them are very, very specific, like greening the OR, and some of the chemicals that we use, and infrastructure resilience, which is actually a piece to this, because we've seen from Hurricane Katrina and Ida and Maria that we have to have resilient healthcare systems in the face of climate emergencies. So I'm just going to go through some of these. I have the link on the bottom for the full document. It's 35 pages, so I don't know if you're all going to feel like reading through all of that, but I just wanted to highlight a couple of these. So for leadership, and again, my apologies that this is formatting a little bit funky, but so leadership is incredibly important no matter what industry you're in. You want to have top-down leadership, and I have some suggestions here for who should be part of a green team, because certainly getting buy-in from physicians, from nurses, from people in your lab and infection control can certainly help to build excitement about this. There have been some interesting works on financing, because many hospital systems have very tight operating margins, often a 2% operating margin. And so the business case becomes really critically important. We have to take care of patients. We have a lot of other responsibilities. So thinking about creative financing and considering things like power purchase agreements or shared savings agreements. As I was saying, that the procurement is really important. So talking about what we're going to do with our scope 3 emissions. And because we are large health systems in general, we can put pressure on supply chain, and we can demand certain things in terms of packaging and decrease waste and reusability even. When we're looking at waste, there's hard and fast targets that we can try to set. So a lot of waste is generated just by one hospital day, usually about over 30 pounds per day. So we can set a target of maybe 20 pounds per day. We can try to minimize some of that red bag or hazardous waste, which is automatically incinerated. We can work on our recycling and work on composting and waste diversion. When we're looking at things like water, there have been creative solutions like indigenous resilient landscaping, but we also think about the water that we're using to clean our hands and switching to an alcohol-based hand scrub where there's no impact on infection control, which is obviously a concern. The OR is really a huge opportunity because it produces about 30 to 40% of a health system's waste, and per square foot, it's about almost 6 times more energy intensive. So we could spend a lot of time focusing on the OR, even thinking about the type of anesthetic gases that we're using, because different anesthetic gases are more potent in terms of greenhouse gas emissions. Things like nitrous oxide are almost about 3 or 250 or so times more potent than CO2. So thinking about how we can diversify our anesthetics so that they're less potent. And our energy systems, certainly, we can make use of energy audits, we can divest from fossil fuels, but eventually moving towards renewable energy should be a goal for many health systems. And then education, whether it's within our own health systems, whether it's educating colleagues, nurses, pharmacists, but also educating the public and educating our patients. There have been some very creative studies done on this, educating pediatric populations and their parents. So this is certainly an opportunity for us. In agriculture, often in a lot of communities, the hospital cafeteria is one of the biggest restaurants in the area. So thinking about Meatless Mondays, thinking about offering more plant-based diet options are good for patients, and it's certainly good for the environment. And we talked about things like composting. There's also things like the Cool Food Pledge, which is New York based, and it helps to, it offers a calculator, it helps to decrease your emissions. The goal is about decrease by 25%. When we're thinking about chemicals, that can be the chemicals that we're cleaning with. We have obviously very high infection control standards. So cleaning with green products, it's also good for hospital employees, but also if we're purchasing, making sure that we're purchasing with less caustic chemicals. Construction, when we're talking about construction, a lot of the hospitals that we're building now will be around for the next 50 years. And only 3 of the, I think it's 2,700 or so buildings that are LEED certified are actually healthcare LEED certified. So there's a lot of opportunity to build around LEED design. And travel. So installing EV stations is wonderful, but also thinking about our whole fleet of ambulances and decreasing idle time, and incentivizing virtual participation, trying to minimize people going to conferences. People love to go to their annual conferences, but trying to switch to virtual options. And then healthcare system resilience. So there's a lot to this. There's a lot to not just the healthcare system becoming resilient, but integrating with non-governmental organizations, with communities. Because if you have an infrastructure that's resilient with the hospital, but you have flooding in the environs and the ambulances can't actually reach the hospital, then you don't have a resilient system. And this has happened before in parts of New York and Connecticut, where hospitals have worked on their resilience, but the community hasn't. And so the patient care has still suffered. So this was a very, very quick overview, but I did just want to highlight some of the important things about climate smart and resilient healthcare. I do also talk a lot about the benefits of going green that are more tangible with overhead cost, morale, engagement, and community health. And there are certainly other resources, including Healthcare Without Harm, Practice Green Health, and now the American Hospital Association, which provides some excellent guidance on this. And My Green Doctor is wonderful for the outpatient setting. So I will stop there. I will stop sharing, and I'm happy to take any questions or comments from the group.
Well, Lisa, I just want, oh, I have feedback. Are you okay now? Okay, am I okay is the question, I guess. I just want to let you know, we have some very positive comments. Appreciation that you're actually doing such an incredible and systematic review and implementation approach to all of these many issues. And one of our colleagues here has a question, again, appreciation that you're looking at the impacts of climate change on health. The question is, can you give us a sense of how widespread that appreciation is, the connection between climate change and health among physicians?
Yes, so there have been several studies done on this, and as you might expect, so physicians are well-read and are scientists, and so many will understand, about 90+% understand the impacts. They don't feel that they have the necessary tools, the education, because certainly I wasn't taught this in medical school. This is now just beginning to come to the fore. In 2035, the ACGME, which is the regulating body for internal medicine, has put in place a climate health fellowship in internal medicine. That's in 2035. There's been a call in 2019, 200 medical journals put out an editorial saying that we need to take this very seriously. The AMA has put out a suggestion, not yet a mandate, but that climate and health needs to be integrated in medical schools. It's not yet mandated though. Certainly some schools are farther ahead than others. But medical students are really driving this at a lot of medical schools. So they're pushing their deans, their faculty to build this in more rapidly.
Well, that's great. I think that the more we can get the message out, the better off we are, of course. And everyone knows that physicians are very trusted people in our population's lives. So I think that this will be a terrific asset. I have another question, which is, we know that you mentioned how large the healthcare industry is and how powerful it is because of that. And I think we all can recall that Walmart made such strides in actually impacting energy consumption because they had such huge purchasing power worldwide. Right. So we saw the size of detergent containers being reduced and all that sort of thing because of Walmart. It seems to me that there is a great impact of scale on the part of the healthcare industry. Are there particular areas where you see that happening, or?
Yeah, it's a very interesting question. So I'm going to go back to England. So so the NHS is far ahead of us. So they are laser focused on sustainability. They're aiming for net zero at 2050. So they are already building in plans for their supply chain now. Now, granted that's UK, but because of globalization, there is some overlap with our interconnected supply chains. I mean, we saw this with Hurricane Maria when Puerto Rico was hit, and we had huge supply chain disruptions of our IV fluids, which were largely made on the island. So certainly there's the globalization perspective is important. There are, because that the US healthcare system is not nationalized like the UK, it's a little bit harder to get traction, but we are starting to see some of that. So there are health systems like Kaiser Permanente, which is already going carbon neutral. There is, Stanford, there's Gunderson, there's plans for a lot of other places. So it's starting to catch up. But my hope is that with a lot of the modeling, there's a slightly slow rise, and then it starts to increase more logarithmically.
Well, thank you. I think you've given us so much to think about, and I'm betting that a lot of us are going to look to make sure that the healthcare industry is better represented on our green teams because we have a lot to gain from that and hopefully something to give. So thank you so very much. One of our participants asked if the slides will be available, and it's a good time for me to mention that, of course, this whole meeting is being recorded. So all of this information will be available to.
I'm happy to share.
Thank you so much, Lisa. We do greatly appreciate it.